Good morning. Welcome to the Senior Hour, which is sponsored by Comfort Keepers in-Home Care and Advanced Audiology. I'm Barbara Cochran with my co-host,
Dr. Jean Dorio.
on your hometown station, KHTS. This is a show for, about, and by seniors, giving information to enhance one's quality of life. And our first guest this morning is Dr. Rafael Rosado of Kaiser Permanente. Welcome, sir.
Welcome.
Thank you very much, Barb.
Nice to have you. And later in the hour, we will have one of our sponsors on, Miles McNamara of Comfort Keepers in Home Care. And Dr. Rosado, what we'll be talking about today?
Well, today we're going to be talking about the new Santa Clarita Medical Office, number 2. Awesome expansion here in the Santa Clarita Valley. And then if we have time, we'll also be talking about the needs of our elderly, their special needs, and things that they need to stay in the home. It's important. We want to stay in our homes.
Absolutely. Absolutely it is. Well, that's wonderful. Well, tell us about the new building.
Well, you know, the new specialty building is the centerpiece of Kaiser's new Santa Clarita Health Hub. It provides specialty medical services delivered in KP's new collaborative concept. It's the heart of the complex is an indoor public square which draws visitors into a dynamic yet relaxing atmosphere that encourages them to participate in the health initiatives offered or to linger in quiet educational settings. Specialty services will be many. It'll include services as cardiology, hematology, oncology, nephrology, neurology, ophthalmology, orthopedics, podiatry, and of course, we'll have the awesome services of our urgent care physicians.
That's a lot of ologies.
Yes, it is.
I got lost halfway through them.
So you mentioned, though, Ralph, that it's Kaiser Permanente Medical Center 2. Where is Medical Center 1?
It's just a block away.
Oh, okay. So now where are we talking about for our seniors who are listening to the show? Or where in Santa Clarita is this?
We're off of Turney Road,
Uh-huh.
and I don't have the.
But Turney Road
address.
that goes just north between Magic Mountain Parkway and McBean
and Valencia.
Valencia.
Yeah,
okay.
between Valencia and Magic Mountain.
Just going up from COC.
Right,
You take that road there.
Yes, sir.
Okay,
Right by
I know
the
where it is.
Quest Lab.
So there's now a second building there, but it will have an urgent care there also. But I noticed in the ologies that you had mentioned, internal medicine is not quite an ology, but under internal medicine is geriatrics. And, our senior listeners are going, okay, I belong to Kaiser. I want to make sure that when I go there, somebody will be an expert in geriatric medicine. And I'm sure you have those because a lot of my friends work for Kaiser and they're there.
Yes, we do.
Yeah.
Yes, we do have that. And of course, the regular primary care services will continue at our first medical office building.
That's the big one
Yes.
that takes a whole corner.
Yes. Well, the new building also includes a high-rise parking structure, which is something we all need to make it easy for seniors to deliver, to come to the clinic and easy to access the services there.
And that's a good question because the seniors who are listening, I think they know better, but, some of them are not as mobile as, they would like to be. And does Kaiser offer transportation sometimes to their patients who are in their clinics or trying to get to their clinics?
I was talking to some of our administrators, and that is in the plan to have some kind of transportation.
That'll be great.
From the parking structure to the clinic,
or you
and
can
also to the new MOB.
You can Uber them in or Lyft them in.
That would be great.
Literally,
That would be great.
literally.
Yeah, I do have an address. It's located at 26877 Turney Road in Valencia. This new facility, of course, will bring all kinds of skilled surgical teams. We'll also have 2 operating rooms there for same-day surgery. Great.
Outpatient surgery. That's super.
Yeah.
And do you have a telephone number?
Let me see. Do we have one? Oh, our main line. Yes, the main Kaiser line. I'm sorry. I'll get that to you in a second.
But with that, we'll want to, there are hours that go along with the clinics there. So that I
Yes.
think that's important that people are aware that, it's not like 9 to 5. This is like 8 to 8, something like that.
8 to 8:30. Yes,
Yeah,
sir.
it's over 12 hours
Yes,
of
sir.
accessibility. Now, does that go along with the urgent care as well? Are those the hours, or is that a 24-hour yet?
No, no. We would,
You'll be working long hours.
yes, sir. No, our urgent care services are, high acuity urgent care. It's not just your regular urgent care. We see all kinds of patients in different settings. Our urgent care type is clinic focused on the delivery of urgent and sometimes emergent and ambulatory care. And it's done in a dedicated facility other than a traditional emergency department. So what we're trying to do is avoid the emergency department visit and stabilize you. And if you need to be transferred, then we'll take care of that and make sure that you get to a Kaiser facility if that's the case. Or if it is emergent, then to our closest emergency room.
So I could see a patient, saying, I don't feel that well, and they can, end up, they can go to their doctor at Kaiser, and doctor says, I don't like how you're doing. You need to get downstairs to the urgent care because you're at that level. Don't have to send you to the emergency room, but you're at that level. What about those who are sitting at home going, okay, I don't know if I can make it to the urgent care. Should I call 911? What will differentiate between our patients making that decision? Because that's not easy. How do patients, as physicians, we can say, yeah, you need to get to the emergency room right away, after a small discussion. But how do we rely on our seniors to say, where do I go? Let's flip a coin here. It's not a comfort zone for them.
That's correct, Dr. Dorio, and that's an important question. And the answer to that is we have a wonderful nursing online nurse line where you can call. It's actually you can call the central number. Also, it's 888-778-5000. That's 888-778-5000. We have wonderful nurses there that follow algorithms and get you to where you need to be. If it's the urgent care, we already have algorithms where questions that they ask you that will take you and directly to our urgent care. And if it's a little bit more complicated, they'll know and they'll recommend the emergency room. So it's important to call with any doubt that you might have, but we're available. We're high acuity, and we have a wonderful staff of 7 urgent care physicians, all family doctors, by the way.
Very good. But just so our listeners know that if they're at a point in their emergency or whatever's going on with them, and they're trying to reach for this number, 888 number, and they know they're not going to make it, that's not a time to call 888. It's 911.
Yes.
So just so they keep that in mind.
Yes, very important. Thank you.
Okay, what was the other subject we were going to talk about?
Well, there's always lots to talk about. One of the things that I wanted to talk about is the problems that senior members face with their caregiver issues. We know that seniors have specific problems and issues or situations, for example, chronic problems, memory issues, sometimes issues with activities of daily living. And we have ways where we can connect with our social workers, groups, with our community to help assist. We have Kaiser Home Health. Which is very good, and these social issues are a big part of our seniors' problems. 70 to 80% of senior issues are social issues, believe it or not.
Absolutely,
and we help support that through our social workers, and also through our friends, for example, like Comfort Keepers, that help and go to the community and do what needs to be done to keep that member healthy at home.
Yes.
and that's the key word, because what we're trying to
At
do
home.
in our society right now, a huge number of our patients die in the hospital or die in nursing homes. And they don't want that. They want to be in their own home, and we have to find a way to be able to sustain them in their own home, and for them to get to their doctor, and sometimes that just gets more difficult. For us to bring medicine to their home will allow them to stay in that home a lot longer. So this is our goal. This has to be society's objective, and Kaiser is really leading the way on that.
Oh, you bet. Kaiser's doing everything possible in the preventive care arena, including annual wellness visits, initial preventative exams. Everybody that's on Medicare gets an initial preventative exam, screenings for diabetes, nutritional therapy, screenings and counseling for obesity, smoking cessation, depression screening, which is very important for our seniors.
Oh, absolutely.
Very
That's
important.
That's critical, in fact. It really is.
Glaucoma screening, taking care of your vision, because vision is everything. We use all our senses, but the vision is our number one sense. We also do lung cancer screenings, physical therapy to prevent falls. As we age, the way we walk changes, and we do some preventative things to help you continue to get around in your home, and much, much more, because it's not just about the medical services, it's about caring for our community.
Yeah, and Miles, who will be on in the next half hour, will talk about how when one goes to a patient's home, and I do house calls, so I know when I walk into the home, I'm looking around already for the problems that might, a hassock in a way, a extension cord that they might trip over, furniture that's just absolutely in the wrong place. These are things that are simple, but they will take our patients out of harm's way for that fall that eventually puts them in the hospital with a broken hip. So we're trying to be preventative and make sure that, they don't sustain some huge trauma or, home-ending type of catastrophe that ends up, putting them out of their home into a nursing home. That's the last thing they want.
Exactly. And also, as part of that, we also have to look at the social supports, because a lot of our seniors, have lived a long time, and sometimes family isn't close by. So, Comfort Keepers helps us with that, and also we help empower caregivers to do what is needed to keep that family member at home in an atmosphere of love and compassion and dignity.
And, we have in our community churches who are involved, Senior Center who's involved. There are clubs and organizations that Barbara belongs to that are always helping our seniors out. The social services that are out there for our seniors are tremendous, especially here in Santa Clarita. But, to rally them and corral them and put them in a place where people can see them and have them available is important. And I don't think that's hasn't happened a lot, but I can see what Kaiser is doing. They're putting that out there for our seniors to take advantage of.
Well, it's really, really very important for seniors to be able to stay in their own home. They're more comfortable there. They like their surroundings, and it's critical. It keeps them from being depressed many times, because if they go into a nursing home or a place like that, they're going to be gone in no time flat. They really aren't. If they aren't in their own home, in their familiar surroundings, it's devastating for them. And we have an extremely large senior population out here in Santa Clarita. And we love our seniors, me included.
Of course.
But we have to energize and powerize society now to start looking at this aspect of how we're going to manage healthcare, because healthcare is expensive, but it's even more expensive to take our senior patients and put them into facilities where they're not happy, they're depressed, they're out of their comfort zone, rather than keeping them in their home, which is cheaper and better for them, and it allows them to prosper, I think, and live longer and live a better life. But I think society has to find those models, and here in Santa Clarita, we have that model right now. And I think it's going strong with Kaiser being involved with this, Comfort Keepers as well, putting their ideas together to show that, hey, we got experience in this, and this is what we're going to do, and statistically show that this is a great model for not just our community, but around California and the United States.
Dr. Dorio, you hit it right on the head because what we're looking is for sustainability. In order for it to be sustainable, we have to look at the cost. And because, well, you know, healthcare is very expensive in our country. And even more expensive if you fall and break a hip and you need a hip replacement. And even more expensive if you have complications while you're in the hospital. Hospitals are great places, but they're also places that you can feel very lonely and very out of touch. So I think to make it sustainable, we have to look to the community. We have to look to our leaders, our community leaders, with vision, that we can see what our seniors need to stay home. Home is the best place to be.
Absolutely, it is. Because it solves a great many problems. It really does. And keeps problems away. Because seniors they're happier at home. Much happier.
Oh, definitely.
I would be miserable if I had to go stay someplace if something happened to me. Absolutely miserable. And especially when you have pets at home, because you can't take your pets with you to many facilities.
That's
you
right.
know, they don't allow it. And pets really are a mainstay for seniors. Seniors love their pets, love their dogs, love their cats, even their canaries, you know, and
Barbie,
their fish.
And you have outside your home in her backyard birds.
Oh,
And you
two
have,
bird feeders.
and you know those are her friends also. So it's an environment that you know we feel sheltered and we feel comfortable in. But when it comes to losing that, the potential of being in an environment like a nursing home, which is not conducive at all for any of us to be living in, it's not good enough for our mental nor physical health.
Correct. And doctor, also, we've got to think about home care and hospice when that time comes, because that time will come, and the what ifs will start to emerge. What do we do when that moment comes and we have to make that decision for end of life care? Well, again, we look to the community. We look to hospice care and services. You know, our members can receive care from any Medicare-approved hospice program located anywhere in the United States. The original Medicare program will pay for the hospice provider for services the member needs and receives, and the hospice provider can be a plan provider or a non-plan provider. Members may change their decision to receive hospice at any time. And my own experience is that members will start the hospice program, and believe it or not, they rally, they get better. Then they get off of it, and then it continues because life is precious, and we want to live it to the most with dignity and with love from our family members and at home.
Absolutely, especially at home. And hopefully many of our seniors had purchased long-term care insurance. I mean, it's very expensive if you wait later in life to get it, but it's quite inexpensive if you get it at a younger age, and it's something to think about because we've had to use our long-term care insurance for my husband on a couple of occasions, and it's been worth it, every bit of it.
It's worth it because he's been able to stay in his home.
Absolutely.
That's the big part of this, and that's what I think across the board we're all trying to achieve. Whether government recognizes what we're trying to do, I don't know. But I just know that having dealt with seniors for 36 years, I know that this is where we better head as a society, not just for cost, but just to take care of those who have served our nation, to make sure those veterans and the seniors who have played a role in moving us forward will have some good life toward the end of life. And if we don't do that and sustain that, then we're not going to be a good nation. And I don't think any of us are willing to let that happen.
That's correct, Doctor. I'm glad you brought that up because, you know, many of our loved ones, even into their elderly age, they're still part of the community. And a lot of them still are able to function, and even if it's storytelling, I mean, storytelling is important. And knowing what their needs are is important. That's why a lot of these covered services in hospice, cover, drugs for symptom control, pain relief, short-term respite care for your loved ones that are taking care of you, and other services not otherwise covered by original Medicare. So home care is the name of the game.
Mm-hmm.
Absolutely. And I think we need to take a break. It's been wonderful having you here.
Thank you.
And hopefully
welcome
you will
aboard.
visit us again.
Oh, you bet.
Terrific. Thank you again. I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on your hometown station, AM KHTS.
Healthcare can be difficult if you're underinsured or have Medi-Cal. Samuel Dixon Family Health Center can help. Services are available on a sliding fee schedule. The mission of the Samuel Dixon Family Health Center is to give the Santa Clarita Valley access to affordable, quality primary care. There are 3 locations to serve you: Canyon Country, Newhall, and Valverde. Go to sdfhc.org for more information and to find the location most convenient for you.
Aloha, friends! We invite you to come by Honu Coffee, home of the best cold brewed coffee. What makes our coffee special is how our organic coffee beans are infused with nitrogen to create a smooth and delicious cup of coffee. You'll also find traditional bold coffees and island-inspired signature drinks. We're the perfect place to catch up with friends or just relax with your favorite cup of joe. Honu Coffee on Lyons Avenue and Walnut in Newhall. Stop by and say aloha!
Do you like to rock across Africa?
Then the wait is over.
Africa Rocks! Africa's Greatest Hits is now available at the San Diego Zoo! And who could forget 99 red baboons?
Or the African crested porcupine smash hit, I Got Quills to Pay the Bills! Hey, don't get too close!
And the hits keep on coming!
Africa Rocks has all your favorites from 6 different African habitats.
Hungry like a leopard!
Ibex is back!
Harder, better, Fossa stronger!
And a new track from Kendrick Lamar!
Now, Larry.
Yes, Chuck?
A collection of this magnitude, I'd fly to Africa!
Well, don't pack your bags, friend. Africa Rocks is only available right here at the San Diego Zoo.
Wow, that really does rock.
No, it Africa Rocks.
Welcome to Africa Rocks. Experience 6 different African habitats, including our first ever aquatic enclosure with African penguins. Only at the San Diego Zoo.
At Advanced Audiology, we know how important hearing is to you, your loved ones, your work success, your safety, and your ability to stay in the game. Most people won't admit hearing loss to themselves or others. We make it easy for you. Today's digital hearing aids come in a variety of styles, including invisible. All feature-rich, providing unparalleled hearing quality, wearing comfort, and automation that simplifies your life. Don't be fooled by our imitators. There's only one Advanced Audiology with the purple sign, next to AAA on Valencia Boulevard.
First impressions say it all. Choosing the right makeup is critical to that first impression and keeping your skin looking young and healthy. That's why Santa Clarita's Jen Gerard created Gerard Cosmetics. Inspired by women of all ages who gravitate toward classic and timeless beauty with a modern twist, Gerard Cosmetics. Superb quality and pigmentation, along with lip glosses and lipsticks in colors for everyone. The internationally acclaimed Gerard Cosmetics. Discover your new look at GerardCosmetics.com.
Hometown.
Traffic report, simple news, weather, and lots of music. They pretty much play everything.
Your hometown station.
Will you still need me? Will you still feed me when I'm 64?
Welcome back to the Senior Hour. I'm Dr. Jean Dorio with my co-host, Barbara Cochran, on your hometown station, KHTS. We're joined by Miles McNamara from Comfort Keepers in Home Care, and we've mentioned your group several times because I think in this community we are looking at a great model of how we are attempting to keep our seniors in their home, and that's what Comfort Keepers does.
Right, and I was very pleased driving in hearing you guys talk about Comfort Keepers on the way in, because you're right, and Comfort Keepers in Home Care has a great relationship with Kaiser. We're actually a vetted partner with them, so any Kaiser folks that are listening, you get a 5% discount with Comfort Keepers for home care. But absolutely, the goal is to keep people in their own home. That's where they want to stay. And Kaiser is such a great organization in that they've done the metrics on the business side and the studies on the emotional side of the cost effectiveness and the emotional stability aspects of keeping someone in their own home. A lot of times all they need is a helping hand with some of those activities of daily living, which is what we do. As you know, Doc, home health will jump in. They'll do a couple things medically that they've been told to do by you as a home health prescription, and then they're gone. And now they need help with making a meal, staying on their medication schedule, maybe in and out of the shower, or just things that we need a helping hand with to keep our seniors in their own home.
And Dr. Rosado even said it's sustainability. That's what we're looking for. We have the immediate care that we have to give our patients, especially when they've just left the hospital. But the long-term care is more important because it readapts them to living at home and makes it easier for them to survive.
Right. And talking about long-term care, I want to step aside just for a second so I don't run out of time. And I understand that the famous Barbara Cochran has joined us for this coming Saturday. Is the ongoing caregiver. Am I right with that, Barbara?
Yes,
got an
Saturday
email that
morning.
You're the moderator.
Yes.
It's an ongoing series that the College of the Canyons and the Senior Center have partnered up with, and it's the what's the official name of it? They call it the Essential Family Caregivers Workshop Series. This is the fourth one, and they've all been pretty well attended. And this Saturday, the 18th, from 9 a.m. to 11:30 a.m. The topic is the ABCs of long-term care options, and so there's going to be a lot of different options out there discussed and shared. For folks looking for assisted living facilities, maybe in-home care is the answer for them. Hospice, skilled nursing facilities, and who pays for them. So we have a great panel that's been put together by Paul Wickline over there at College of the Canyons. We have Ann Front from Henry Mayo, who's going to be talking about palliative care. And that will segue into hospice care, which we have Flora Greenhill with Assisted Hospice there to talk about that. Then a gal that I know from, I don't know where, Jane McNamara. She's from the McNamara Law Firm. Of course, she's my wife. She's going to be there talking about a lot of the legal aspects of long-term care and some of the things that get involved. Then I will be on the panel to talk about home care as well. And then Margie Weiss from Oakmont Assisted Living here in Santa Clarita. She's the executive director. So it's a great panel. Barbara Cochran is going to be our moderator.
Yes.
We're going to be taking questions from the audience. People have been submitting their questions ahead of time. But if you've got the time, folks, if you or someone is taking care of an aging loved one, and you're thinking down the road of what's your choices that are out there, this Saturday, November 18th, from 9 a.m. to 11:30 a.m. I'll give the information to the studio here, so you can either call KHTS or call me at Comfort Keepers. But to register, and I say that because if you're driving, you're not going to be able to write this down. The phone number to register is 661-362-3118. Or if you are where you can write something down, you can go to the website as well, and it's crisisplanning.eventbrite.com. So there's a lot of stuff there to remember. So again, either call the station here or call me. I can give you information on how to register for this Saturday because it's really important stuff.
And where is this going to be located?
It's at the Senior Center. Good point, Barbara. Thank you. It is held at our Santa Clarita Valley Senior Center at 22900 Market Street.
One of the things, Miles, that I want to point out to our listeners, and especially those caregivers, because there are people out there that don't realize they're caregivers. There are people out there that don't anticipate that they're going to be caregivers. And, if you're one of those, the generation that is taking care of your kids still, but also taking care of your parents, the sandwich generation, realize that even though your parents are doing okay, you don't know when something is going to happen. And doesn't it seem, Miles, that what we end up doing is seeing people, caregivers, in a panic, that something has already just happened, they've fallen, and, now they're requiring care, as opposed to saying, okay, something just happened, and I noticed a memory lapse, something just happened, and they did fall, but nothing happened. I mean, these should be clues to people that they're going to be big-time caregivers in the future, and they should be attending this.
Well, and not only that, it's kind of ironic. It's like you and I were connected at this cerebral level today because, I'm not kidding. Look at the notes I've written that I wanted to talk about, and it's the advocacy aspect of being a family caregiver. And a lot of times when we're unexpectedly thrown into that role of a family caregiver, or we see it coming, we know we're going to be. So I really want our listeners to think about, because nobody, plans to fail. What's the end of that cliche? they fail to plan. And the thing is as we become advocates for our loved ones, we need to legally take a look at what that means. And I've talked about it before on my show, Aging with Power, right here on KHTS, and I know I've talked about it with you guys too, but it bears repeating, is if you do not have an advanced healthcare directive, you need to get it done.
Absolutely.
And it's the legal ability to talk on behalf of whoever you're the advocate for. And a lot of the other side of that coin that a lot of folks don't stop to think about is if you have adult children who have reached the age of 18, they are now legally an adult. So you can't play the dad card. You can't play the mom card. You can't walk into the hospital if, God forbid, they've been in a car accident or something and they can't speak on their behalf. And you walk in there and you say, Dr. Dorio, this is what I want done. You say, who are you? Well, I'm the dad. Oh, that's nice. Let me see your advanced healthcare directive. Same thing. I'm going to be shut out. So again, folks, look down the road legally. Plan what's going to happen and sit down, and I call it the talk. You mean sit down and have a talk with your folks before it becomes an issue so that they can talk about all the things that, ask them, how do you see this playing out? What do you want your long-term care option to be? What happens, and I know you know this because the old DNR has now been, which stands for do not resuscitate, which is a choice some folks make, that's been replaced by the PULSE, which is another acronym, which stands for Physician's Order for Life-Sustaining Treatment. And again, it's like a roadmap for you. I mean, I'm sure you can expand a little bit on the PULSE and how it comes into your practice, right?
Oh, absolutely. And fortunately, I've been integral in knowing the Judy who has developed the whole PULSE. And I was on panel with her at USC a few years ago, and she knows that this document is evolving. It hasn't been stagnant at all for years that she's been involved with it, and she's always looking to see that we're changing it and making sure that our patients and our caregivers are knowing that there are changes going on there too. So it's an important part of what the legal part of what we need to have in place in case something happens to you.
Well, the thing that I always tell my clients and folks that when I speak about it is it takes away the gray area, it takes away the guilt, and it takes away the arguing between siblings of that's what mom would have wanted. Well, geez, what if like months and months and months ago you all calmly sat down over a cup of coffee and talked about all the hypotheticals that could happen in our lives, and you say, if this happens, I want this. If that happens, I want that. And so there's no reactionary aspect to it. It's all being proactive. And you're sitting down and saying, okay, mom, if, and this is a misunderstanding that a lot of people, folks, you hear them say, I never want to be on a machine. Well, let's back that up a minute. What does that mean? If you're going to be on the machine for the rest of your life, that's one conversation. But what if you're going to be on that machine just for a day or two or maybe a week to get you over the hump, and you're going to come off that machine and live a long, healthy life after that? So if you put in your PULSE that you never, ever, under any circumstances want to be on a machine, well, you might be, misinformed, and you may be taking away an additional 10 years of your life. So again, talk about it when it's not a reaction, but you're being proactive.
Exactly.
And the thing is and it doesn't always have to be your oldest kid either. So when you're picking that agent for your advanced healthcare directive, you're basically picking somebody that's just going to follow a roadmap. There's really, as I said earlier, there's no gray area. They're just going to say, okay, well, what's the Dr. Doro, would you say? Okay, well, see, let's go to page 3 of mom's. She said if that happens, this is what she wants. Because now brother and sisters don't have to step out in the hallway and argue about it. It's right there in the roadmap, and they've laid it all out of everything what they want to happen. So the advocate, the agent on the advanced health care directive doesn't even have to be a family member. It just has to be somebody that even if it's a tough call, are going to follow your directions.
And that you can trust.
Right. And that's the big thing.
What does that PULSE stand for again?
Physician's Order for Life-Sustaining Treatment.
Physician's Order
for Life-Sustaining Treatment.
Why did they put such a long one in there?
I don't know. They did make it kind of wordy, didn't they? But again, it does kind of replace the old DNR, but it's more elaborate than the DNR. It really goes into more. There's other aspects of that pulse that you can talk about and give directions for whoever you've put in charge.
So it's more inclusive
Yes.
than
Yeah.
the DNR.
Yeah, but what's more inclusive also is the Advanced Healthcare Directive. Is once you put that person in charge, you can be. I mean, there's a lot of good websites where you can go out and get sort of I call it a generic cookie cutter kind of Advanced Healthcare Directive. But a lot of times in today's age, you've got second or third marriages. And actually that kind of segues more into what I was going to talk about as far as having a trust, because it's like that's another thing you want to talk about when it's not an issue. You want to have a nice cup of coffee and be proactive and say, where do I want my assets to go when I leave this world? And again, today's age, we've got second, third marriages. So you've got mine, yours, ours. You've got maybe a special needs child involved. So again, some of those cookie cutter ones are okay. But when you go to an attorney to have it done, which is what I recommend, is you can put all the nuances in there. You can put all the what ifs, and then also you have all your assets basically become property of the trust. And similar to the Advanced Healthcare Directive agent, you pick somebody to be the trustee. And it doesn't have to be a family member again. Again, really, in other words, becomes the executive of your orders. They're going to take that trust and they're going to go to an attorney and they're going to say, okay, mom's gone. Let's see where she wanted her things to be distributed. Because the biggest thing you want to avoid is probate. I mean, not only is it going to be very expensive to the estate, but now you've got the courts involved, and you do
costs
not
a lot
want
of money.
judges in
Subtracts
there.
out a lot from the total assets that are present.
And the trust eliminates that.
The trust eliminates that
does.
because all your assets become part of the trust, and then you have a trustee who then will execute the orders of the trust upon your passing.
But this will all be discussed on Saturday, and this is where people should come with their
Well, not so much
questions.
the trust. I mean, actually, Jane talked about that in her preview. We had a couple of weeks, 3 weeks ago. We talked about that part of it. It could come up this Saturday because the questions are open to the attendees. But this Saturday is going to be more about when you're looking at long-term care options. Is that home care? Is that hospice and palliative care comes in obviously once we've been diagnosed with something. But you have assisted living. You've got senior living. You've got in-home care. You've got board and care. So you've got a lot of different choices out there.
But how it's going to be paid for sometimes comes through the advanced directive of where your finances are, and that's what Jane does very well. She has that set up in some way so that it becomes easier as well. There's no debate over it. There it is in black and white. So that needs to be always a part of the discussion, and people are always asking that.
And there's so much misinformation out there.
Absolutely.
And people don't understand, as far as the tax ramifications of making the wrong decision. They're going to quick claim the house over to the kids, and they don't understand, and I don't want to get into it here, the whole basis change of the value of the house, and now you've got capital gains taxes and all these things that come into play because you didn't know the rules. Someone who didn't know the rules was giving you advice about those rules, and it's just sort of an ongoing spinning out of control with all this misinformation.
Yeah, you run into a big mess.
Right.
Absolutely.
Right. And there's very
call it a
specific
mess.
laws when you're when you're planning for Medi-Cal and you're putting all the assets legally where you need to put them, and don't quit claim your house over I get the house out of mom's name. No, because the house is an exempt asset in many cases. So again, it's interesting to hear the misinformation being delivered by people who think they are so right.
Yeah, and we did our living trust about 12, 15 years ago. And in talking with attorney Caden, is it?
Randall Caden?
Randall Caden. He's an elder law attorney, and we have to go in to see him to make sure that things are up to date.
Right.
with the newest nuances and the words and all of that.
Well, and
changes.
tax
And the
changes
changes.
and stuff. Yeah, because
Yeah.
the rule of thumb is you should have your estate plan or trust reviewed every 3 to 5 years.
Yeah, and we really need to do that because it's, our house is paid for now,
Right.
which makes a big difference.
Absolutely.
But
But again, that house is still an exempt asset in many situations when you're looking down the road. So a
That's
lot
right.
of folks don't understand that, and they're thinking that they're doing mom a big favor to quick claim that over to the kids, and it just throws everything into turmoil.
Well, we've got kids, grandkids now, and great grandkids. So our family is really, really
That
getting
tree
big.
has lots of branches.
Whoa, does it ever? And I think we need to take a break, don't we?
That's what she's doing that
Yes,
dance for.
yes, giving us the evil eye. I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on your hometown station, AM 1220 KHTS.
Drugs or alcohol abuse can tear a family apart. In Santa Clarita, just like everywhere else, it's an epidemic. The Way Out Recovery is here to help. Call them now at 296-4444 or visit them on the web at thewayoutrocoveryscv.com. The Way Out offers outpatient treatment for adolescents, adults, and family members. The Way Out is compassionate, caring, professional, and confidential. You and your family don't have to suffer any longer. Call the Way Out Recovery now, 296-4444, or visit thewayoutrocoveryscv.com and make an appointment. Asking for help is the first step.
Join them for a traditional Thanksgiving feast at Olive Terrace Bar and Grill, featuring free-range roast turkey. Their buffet begins on Thanksgiving Day from 11 a.m. to 9 p.m. Included in their feast are mashed potatoes, candied yam, giblet stuffing, biscuits gravy, and wait, there's more. King crab legs, shrimp, oysters, whole poached salmon, prime rib, short ribs, pastas, salad desserts, and cappuccino. Hungry yet? In Valencia on Copper Hill and Newhall Ranch Road by LA Fitness. Olive Terrace Bar and Grill for your Thanksgiving Day.
The Las Vegas shooting created awareness for all of us. Awareness to upgrade security at concerts. Awareness for clearly marked exit signs. Awareness on how to evacuate safely. And awareness to have tighter hotel security. The law offices of Owen Patterson Owen are working diligently with Las Vegas victims to prevent future tragedies from occurring, as well as protecting the rights of Las Vegas victims to receive financial assistance for their ordeal. If you know someone impacted by the shooting, visit opolaw.com. That's opolaw.com.
At Advanced Audiology, we know how important hearing is to you, your loved ones, your work success, your safety, and your ability to stay in the game. Most people won't admit hearing loss to themselves or others. We make it easy for you. Today's digital hearing aids come in a variety of styles, including invisible. All feature-rich, providing unparalleled hearing quality, wearing comfort, and automation that simplifies your life. Don't be fooled by our imitators. There's only one Advanced Audiology with the purple sign next to AAA on Valencia Boulevard.
Hometown, your hometown station.
Will you still need me? Will you still feed me when I'm 64?
It's not enough. It's too condensed, and
Well, hopefully
when
it whets
we
the
have-
appetite for folks to say, "Hey, I haven't thought of that."
Oh yeah, and they, you
I
have
need to
you
look
really
into
do
that.
have to, because there are listeners who, like I said, they're thinking I'm not a part of this right now, but indeed they will be.
Well, and one thing that you said that I said earlier, and we'll repeat now because it's so important, is as far as being proactive versus reactive. One of the biggest things that home care, provides that is a really undersold asset is companionship. Because that's the biggest thing in our seniors are, isolation and depression. Maybe they lost a spouse recently or a year or two ago and whatever, and they start to withdraw and they become isolated and they become depressed. But the thing that I always tell my adult children, and it's really, really important because primarily the generation that we're serving right now are folks in their 70s and their 80s. And we refer to that as the Great Generation. I mean, those were the folks that were around for, the really instrumental part of our lives in our country and our wars. And there's just there's a whole study that I won't get into now of the different dynamics of the Great Generation versus the baby boomers versus Gen Y versus Gen X versus the millennials. I mean, there's really such a dynamic difference. And one thing about our Great Generation, and that's why, as I said, tell my adult children, is don't use the word home care. Don't use the word caregiver. Certainly don't use the word nurse, because what Comfort Keepers does, helping with the activities of daily living, it's non-medical. So my gals aren't nurses. So I say, tell them we're a concierge service. We're like an executive assistant, and they deserve that type of service in their golden years, because not being a nurse, why make them think that they are losing their independence, that they're losing their ability to be in charge? So I say, tell them that we're a concierge service, because in reality, that's what we are.
You're right.
And
Absolutely.
you deserve that executive assistant. And, we all through our lives, at the peak of our abilities, will hire assistants. We will hire gardeners. We will hire house cleaners. We will hire chefs. So this is basically the same thing, all condensed into one. It isn't home health. It isn't hospice or palliative care, certainly. It's more like having an executive assistant in your house that can help you with meals, that can help you with personal care if need be, can help you, go to the doctors or go to the store, or run errands, whatever is needed on a non-medical level is what Comfort Keepers does. So don't go in and try to be a bull in a china shop and tell mom and dad that you need this and you need a nurse and you're losing your independence and you're losing your...
They won't take to that very well.
I would suggest
they'll throw
that's
it back
the wrong
at you
approach.
real quick.
Yeah, so it is a prideful thing for our seniors, the Great Generation, as I said, that they don't want to be a burden. They want to keep their independence, and they certainly want to stay in their own home. So that's the opportunity that we provide. And as I tell my clients, as well as the adult children, is we're not looking to come in to take over. You're still the boss. We're just here to give you that helping hand and keep you within the walls that you've gotten 30, 40, 50 years of memories collected, and keep you in your own home. Because I'm sure you see this all the time as a physician, that when you displace a senior from their home and you put them in a facility or wherever, a lot of times that's the beginning of the end. They start to deteriorate, they start to withdraw, they start to isolate, and it's really not a pretty look.
No, and they're not in their familiar surroundings.
Exactly.
And if they have pets, those pets aren't with them.
Right. And again, if you have this talk when it's not an issue. So again, if you're in this turmoil now, I feel for you. Give me a call. We'll help you through the weeds. But if you're not, look down the road and have that talk, so that it's mom and dad's ideas, it's mom and dad's wishes, and if again, don't undersell the fact of being proactive. So you think, oh, mom doesn't need this now. Well, let's talk about that. Does that mean you're going to wait till she has that episode where she breaks a hip, where she mismanages her meds and ends up not? So don't wait for an episode to do this. Be proactive. Get somebody in there on a very, minimal level to make sure that they're eating well, making sure that they're hydrating, making sure that they're, taking their medications on time, whatever the case may be. But don't wait till the horse is out of the barn to look at the door.
Yes.
Boy, my grandma would be proud that I used that.
But I think our listeners know that we have an attitude now. We have an attitude in terms of providing good care at home.
Right.
And we have to be able to sustain that. And the model is here in Santa Clarita. You just have to be able to listen and take advantage of that.
And healthcare providers are starting to take that proactive approach. And your prior guest, Dr. Rosado, Kaiser, prime example, is they've sat back and said, well, gosh, if we spend a little bit of money now to save this episode down the road, not only does the senior stay happy, but then they look at it from the business side, like I said earlier, the cost effectiveness of it. So Kaiser is actually one of the first health organizations that are starting to tread into the paying for home care a little bit.
Yeah. So if our listeners want to get a hold of you, Miles, How do they do that,
Well,
other than this Saturday?
Yeah, obviously by phone. You can get a hold of me at 661-287-4200. ComfortKeepers.com is our national website, but if you want to drill down and get right to the stuff that I provide as far as informational YouTube videos and things, frequently asked questions, go to SeniorCareSantaClarita.com. That's SeniorCareSantaClarita.com. And if you just want to chat, if you just want to talk, if you just want to plan, I'll take the time to just sit and chat with you and talk about the different options that you're having down, on the horizon.
Miles McNamara, always a pleasure having you on our show. 287-4200 here in Santa Clarita at Comfort Keepers. Appreciate your help. It's, like you said, it's proactive as opposed to being reactive.
Yeah, absolutely.
Right. Thank you so much. We are sponsored by Comfort Keepers in Home Care and Advanced Audiology. Listen to us next week on the Senior Hour. Now go and enhance your quality of life.